All right. So my name is Dessi Zaharieva. I am an instructor in pediatrics at Stanford School of Medicine. And I'm here today to talk about moving, promoting wellness, and optimizing strategies to incorporate physical activity in our daily routines. So I know for many times when I talk to people, we spend the day sitting at our desks, and often it's tricky to meet exercise guidelines. Today, we will talk about how can we encourage each other and try to meet those exercise targets. So thank you all for taking your evening with me to learn a little bit more and hopefully learn how we can encourage each other to be active. Thanks for joining. So today we'll be talking about exercise and physical activity terminologies and discuss some of the benefits and importance of physical activity for diabetes. We'll also be learning how to utilize strategies for preventing both hypo and hyperglycemia around exercise. And at the end, we'll just talk about some realistic goals for diabetes management around activity. And just so you know, you can add your questions in the chat or Q&A, and we will get to those at the end of the session today. So jumping right in, we will talk about why we should be active in the first place. So we probably already know that regular physical activity can promote numerous health benefits. Starting from kind of the top of this picture here, we see an increase in psychosocial well-being. Although sometimes we hear people say, I don't always feel great during activity, we see that release of endorphins and often feel better in the periods following activity. Even if during, I know sometimes it may not be the most enjoyable, we try to encourage finding activities that are more enjoyable. We also see that even if it's not a primary goal, that decreasing body fat is something that can happen with regular physical activity. One really important aspect when it comes to diabetes, and this is really type 1, type 2 diabetes, increases in insulin sensitivity. We'll get into that a little bit more today, but really just meaning that exercise tends to make insulin work a little bit better. Sometimes people say that they notice when they exercise more, they need a little less insulin. But we don't want to get into this idea that more insulin is bad and less insulin is good, because the reality is that everybody needs a different amount of insulin. And that insulin is needed for our bodies. But sometimes when we are more active, the way that insulin gets used and goes to the body and where it needs to go, it can happen a little bit faster. Sometimes we do have decreases in overall insulin needs. And we also see decreases in the risk of diabetes-related complications. We see increases in muscle strength. In pediatrics, we also see increases in bone strength, improvements in blood lipid profiles, reductions in hemoglobin A1C, and improvements in cardiovascular health and fitness. But I think it's important to highlight that not everybody is meeting these exercise targets, and there are a number of barriers why physical activity and exercise can be difficult to engage in every day for the recommended amount of time. And we'll talk about this shortly. So the larger the word on this screen generally means the larger the barrier. And so as you can see right in the middle of the screen, fear of low blood glucose or hypoglycemia tends to be one of the leading barriers to exercise. We also know that sometimes there are challenges with body image and losing, your diabetes management abilities to keep your glucose in target range. Sometimes there's a lack of motivation, access to technology, in addition to access to gyms. These can be challenges and why people sometimes struggle with meeting these exercise guidelines. So what we want to talk about is how do we actually simplify exercise guidance? We know that there are a number of position statements and consensus documents and published literature. They're really long documents, and sometimes we can get lost in trying to read these documents. So part of my work at Stanford has been how can we simplify the education and the information that we're trying to translate to all of the people living with diabetes, while focusing on a couple of areas like glucose, exercise, carbohydrate, and insulin. And what do we need to do for these four components to manage our glucose levels around activity? And we'll talk a little bit more about these strategies today. But rather than thinking you need to read every scientific paper that's published or even knowing where to find them, we want practical tips that we can take home and be able to utilize every day. So we have some general exercise training considerations and precautions for individuals with type 2 diabetes. Honestly, there are really not that many significant differences between type 1 and type 2 diabetes guidelines around exercise, but a couple of key things that I wanted to differentiate here for type 2 diabetes. Generally, medical clearance prior to exercise that's more vigorous than brisk walking is encouraged. And so this can be from your PCP, from a doctor, from your healthcare team, just to be able to get medical clearance to know that you'll be safe to do that activity. In addition, avoid exercise when blood glucose levels are greater than 250 milligrams per deciliter, particularly if there are moderate or high levels of ketones. We know those could be urine ketone tests or in some cases finger stick blood ketone tests. So either way, if there are moderate or high ketones, we generally want to figure out what's going on first before we jump into doing any activity. Staying hydrated, we will talk about this a little bit more, but is also very important. And of course, carrying fast-acting carbohydrates, particularly for anyone that's using insulin or anything like sulfonylureas. So with activity guidelines in adults with type 2 diabetes, we'll break it up a little bit. We'll talk about adults, we'll talk about older adults with type 2 diabetes, and we'll also look at type 1 diabetes as well. So I know these tables can get busy, but bear with me, we'll walk through each step. The general recommendations for activity are moving more and sitting less throughout the day. So I understand we may not be doing that right now. We are spending quite a bit of time sitting, but the reality is maybe after this, we can go and move a little bit. Maybe earlier in the day, we got some movement. And if not, why not start a new trend next week? And so some physical activity or exercise is still better than none. So don't think that even if you haven't met the guidelines for the day, which is generally, we'll talk about in a second, what these guidelines are, it's still better to do some movement rather than none at all. So for substantial health benefits, we aim for type 2 diabetes to do at least 150 minutes of moderate intensity exercise per week, or 75 minutes of vigorous intensity exercise. As the activity gets more intense, generally the duration of the overall activity for the week can be shortened. Otherwise, there can also be a combination of moderate and vigorous activity. At the end of the day, the focus should also be on muscle strengthening activities that involve major muscle groups on 2+ days of the week. And so we often talk about muscle strengthening activities, some form of resistance training. It doesn't need to be very heavy weights, but encouraging even light resistance band work and balance work as well. When we talk about physical activity for older adults, sometimes I have patients that come and say, well, there's a lot less guidance on what to do as an older adult with diabetes. And really, the guidelines for older adults with type 2 diabetes is similar for that of all adults without diabetes. And the reality is, again, similar to adults with type 2 diabetes, the guidelines are 150 minutes of activity per week if possible. So we'll get to that in a minute, but the first part is as part of the weekly activity, so trying to do, if you can, around 30 minutes of activity per day, adding in some balance training as well as aerobic and muscle strengthening activities. So again, really what's important with older adults is understanding whether and how type 2 diabetes can affect your ability to do those activities. Is there any pain? Are there any challenges? Is there joint issues? And if so, what types of activities can you do to avoid any injury? That's the primary goal with older adults, is that, balancing activities and muscle strengthening activities can help with mobility. But if we can't do 150 minutes of activity per week, it is important, again, talking to your healthcare team, but engaging in as much activity as your ability allows. And that might be different for each person. So in summary, I know this one's going to be also a long and busy slide, but this is why we walk through each one step by step. Those were kind of more specific to adults and older adults, but general consensus guidelines around exercise for type 2 diabetes. Regular exercise training generally improves glucose management. We have seen that this type of exercise training, similar to what we talked about, movement of 30 minutes at least a day of activity, can help with increasing glucose time in range, reducing A1Cs, and overall diabetes management improvements. We tend to see that with studies have shown higher intensity resistance exercise, there tends to be a greater benefit compared to low to moderate intensity. Now, this doesn't mean go and lift the heaviest weight you possibly can. This could also be something more like a circuit workout with resistance bands and resistance exercise. I think oftentimes when people hear high intensity, they think it means it has to be very, very heavy weights. But the reality is we just want to be able to get the heart pumping, and that can be a little bit more beneficial than very, very light weights and doing that for a very prolonged period of time. Again, small doses of activity to break up sitting can help to decrease postprandial glucose levels and insulin levels as well. Like we said earlier in this presentation, the more insulin or the more exercise you do, sometimes insulin levels can decrease. And this is particularly seen in type 2 diabetes. So instead of sitting for an entire day, even if every hour you get up and move up and down the stairs for a couple of minutes, it's important to get that movement in, even in small bursts. It's been shown in the literature also that weight loss of greater than 5% can be beneficial for overall A1C, for lipids, blood lipid profiles, and of course, blood pressure as well. Now, in the cases of individuals with type 2 diabetes that are also using insulin, supplementing with carbohydrates or reducing insulin to prevent hypoglycemia around exercise are generally recommended. So we'll get into the details around insulin management shortly, but really this means reducing the amount of insulin before exercise in addition to post-exercise. If you're noticing after activity, hypoglycemia increases, we can decrease the amount of insulin that we take with our meals post-exercise as well. And then with moderately high volume of exercises, around 4 to 5 days per week, this is generally encouraged to reduce the amount of visceral fat with type 2 diabetes. So again, that's generally the fat around the organs. And this is one of the big challenges about type 2 diabetes is what type of activity can help to do this. So generally it's maybe more volume. It doesn't necessarily mean it has to be very high weight or very difficult activity. Being able to do this a few days a week or most days of the week is encouraged. Now, with youth that have type 2 diabetes, it's also recommended to meet the same activity goals for youth in general that don't have diabetes. One key difference between adults and kids and adolescents and youth with diabetes is the recommendations are actually doubled. So instead of 30 minutes of moderate to vigorous physical activity per day, with youth, it's generally recommended to do 60 minutes of activity per day. And again, at least 20 to 30 minutes of moderate intensity for most days of the week for women that are pregnant. And now we're going to jump into what are the differences with some of the pediatric type 1 diabetes studies, adult type 1 diabetes studies. And this is particularly looking at people with type 1 diabetes or on insulin. This is the largest real world data set that we have. So to date, a lot of the studies that we publish are smaller sample sizes. We study things in, up to maybe 20 individuals with type 1 diabetes, type 2 diabetes. But these larger studies in type 1 have only recently started being published. And this initiative was called the Type 1 Diabetes Exercise Initiative or the T1DEXI Pediatric Study. There was also an adult study, but today I'm going to highlight some of these specifics around the pediatric study that had over 250 youth with type 1 diabetes included in this analysis. And what's interesting is that before we talk about any of the results, just to guide you to what this figure and graph is actually looking at, on the bottom, what we see is the duration of time or the hours post-exercise. We know that exercise can increase insulin sensitivity for up to 24 hours after exercise. So the question was, are there any differences between the type of insulin administration? If someone's using a multiple daily injections or someone using an open loop insulin pump where they manually adjust their insulin doses, or if they're using a closed loop system or automated insulin delivery system. So that's where we see the different colors. So multiple daily injections in red, pump, which is open loop pump in green, and closed loop or automated insulin delivery system in blue. On the y-axis, we can see on either side the mean glucose values. On the left is in milligrams per deciliter. And what we tend to see is that, interestingly, across the different insulin modalities, there were no significant differences, similar post-exercise glucose trends in the 24-hour period, irrespective of the type of insulin modality that they were using. This is a little bit surprising because we often hear that closed loop systems work really well or automated insulin delivery systems work really well. Not saying that they don't, but I think one challenge is around exercise, these systems still require a lot of help from us. And so from people with type 1 diabetes. So we will talk about some specifics here, but I think what's important is that we see kind of similar trends across the 24-hour period post-exercise, irrespective of the insulin modality. When we talk about multiple daily injections, some people are taking long-acting insulin and short-acting insulin with meals. With a typical day, the long-acting insulin, we sometimes call basal insulin dose, we would have our usual dose that we would take day to day. That often doesn't change every single day. That basal dose is usually set. But what's interesting for unusually active days, I work in pediatrics, so I often say if any kids are going to Disney or are going to an amusement park or are going to be walking for a very long period of time, sometimes those days tend to be 8 hours of walking. If that seems to be an unusually active day for an individual, we can recommend for these unusually active days, consider reducing the basal insulin dose by 10 to 20%. And so depending on when that long-acting insulin dose is taken, sometimes it's taken in the evening. It would be the evening before going to the amusement park or that unusually active day that you would reduce that insulin. We never want to reduce our long-acting insulin dose aggressively, and it's important that any changes you make to your insulin doses, you check with your diabetes healthcare team first before making any changes or adjustments. And so these are just two studies I will highlight very quickly that have shown that essentially when you cut back on that long-acting insulin dose, in the top graph, it was insulin degludec, which is an ultra-long-acting insulin. And we can see that in the solid black lines, it was around 3 days after. Because of that long duration and long tail of that insulin, we see that when you reduce long-acting insulin, insulin levels in the body tend to be lower. And so, of course, if you have less insulin in the body and you're going to be really active, it can be helpful to take a little bit less long-acting insulin. In the graph and figure on the bottom, what we see is that after afternoon exercise, you can either give the usual long-acting insulin dose, which is in black, and you can see that here the glucose levels overnight tend to drop. But if insulin levels are decreased by around 20%, so a very small reduction in long-acting insulin, we tend to see a little bit more stability in the glucose concentrations overnight. And this was on individuals with type 1 diabetes using multiple daily injections. When we switch over and start to look at meal dosing, so bolus insulin delivery, this is our fast-acting insulin for diabetes. Again, there are some differences if someone is on multiple daily injections on the left, or an open loop insulin pump in the middle, or an automated insulin delivery system on the right-hand side. So typically, reductions in the mealtime bolus before exercise are recommended if an individual notices hypoglycemia often occurring during activity. So if this is something that commonly occurs, we suggest with the meal before exercise or snack before exercise, if it is an hour or two before activity has started, insulin levels will be pretty high in the body. You can reduce the bolus insulin dose by anywhere from 25 to 75% if you're on injections or an open loop insulin pump. Remember now, we're talking about the mealtime insulin, so this is different than the long-acting insulin dose. If we're on an automated insulin delivery system, one unique difference is that instead of reducing the insulin up to 75%, the reductions in the bolus insulin are recommended to be smaller. Remember that with automated insulin delivery, there is automation. The continuous glucose monitoring system is communicating with the pump, and if we reduce insulin too aggressively with the meal before exercise, say we ate 60 grams and hypothetically took 6 units, and that would be what we would usually take. If we reduced it too aggressively and maybe only took a couple of units, glucose levels with an automated insulin delivery system may start to rise. And the system will often automatically deliver insulin because the goal is to keep glucose levels in range. So it is important that with an automated system, you cut back on that insulin a little bit less aggressively than with the other modalities. We've also talked about many cases where individuals with diabetes experience hypoglycemia, so low blood glucose with exercise. We typically encourage, if hypoglycemia is common with exercise, morning fasted exercise. People might say, oh, why fasted exercise? The reality is that in the fed state or fasted state, there might be some differences in how your glucose levels respond. So with aerobic exercise on the left, we can see that in the morning with a fasted state, with aerobic activity, glucose levels tend to rise. And we'll talk about this in a little bit of why we tend to see this. With resistance exercise and high intensity exercise in the middle and on the right, similarly, we see morning exercise can cause glucose levels to rise compared to the afternoon where we see glucose levels fall. With high intensity exercise in the fasted state, similarly, morning exercise that's high intensity can cause glucose levels to rise versus afternoon exercise. Some people might be wondering, why are glucose levels going up with exercise? And part of the reason is in the fasted state, first thing in the morning after overnight sleeping, no insulin, or you're not taking a meal and taking a lot of insulin before exercise, we tend to see glucose levels rise due to an increase in growth hormone. There is increased insulin resistance in the morning. Part of this also means that without food in the body, we're more likely with this aerobic intensity, as particularly, to see more fat burning rather than carbohydrates. When we talk about continuous glucose monitoring systems, many people are using different types of technology to help manage their diabetes. So with a CGM system, we sometimes see that there's a delay in what happens with their glucose when you look at the CGM values compared to the finger stick blood glucose values. So it's important to monitor this during activity. So we know that real-world CGM data can be used as a tool for people with diabetes to learn about their individual responses to exercise. We tend to see there's an increased comfort during sleep. It helps to determine carb intake that's needed around exercise. And CGM alarms can be really helpful to provide more confidence around exercise. Particularly if people with diabetes can't sense hypoglycemia, those alerts and alarms can be helpful to notify the individual. We've done some studies to actually show that during exercise or rapid changes in glucose, in red here, during exercise and even in the meal recovery, sometimes there's a delay in the glucose values that are shown on a CGM system compared to what's happening on a finger stick blood glucose meter. So we've also seen this with glucose analyzers that are the gold standard. Similarly, the CGM tends to have a lag or a delay in picking up what's actually happening. Part of that reason is because when you exercise, there is a fluid shift that's happening. There are changes that are happening in the body. Heart rate is increasing, blood flow is increasing. But what happens is CGM systems are actually reading interstitial glucose. They're not reading blood glucose. And because of this, we tend to see a delay around 12 to 15 minutes with certain systems during activity or rapid changes in glucose. So what does this mean? What's the take home? We typically say that with CGM values, as you start to drop below 126 milligrams per deciliter, we typically recommend starting to treat with small amounts of carbs. Not waiting until the CGM is reading 70 or below, because during exercise, we do see those delays in glucose monitoring values. So now we're going to jump in and talk about some very soon to be published data that is now in the proof stage and will be online very shortly. We have a position statement that we've been working on the use of automated insulin delivery around exercise with type 1 diabetes. It talks about each commercially available system and how to use it around activity. Some of these systems might not even be available in the US, but we try to offer guidance as an international position statement for every commercial system that's currently available. So if some of these systems don't seem familiar to you when you look at this position statement, just understand some of these are approved in the US, others are approved in Europe, and not all systems are approved here in the US. So the first question is, how do we navigate planned physical activity and exercise when using an automated insulin delivery system? We always hear that planning is important. So why is planning needed for exercise? Well, glucose levels respond very differently to exercise. It's just highly variable. We often say that if you do the same thing today and tomorrow, you may see variable glucose responses. And that's the reality and one of the challenges of diabetes. So with glucose responses to exercise, planning is often needed because there are so many factors that can impact what happens to your glucose levels during exercise. What's your starting glucose before exercise? How much is the glucose changing before exercise? What time of day are you exercising? What's your baseline fitness level? When did you last take insulin or eat? What is the menstrual cycle stage that you're in? And how much insulin do we have on board? This was a study that essentially showed with more insulin in the circulation, we tend to see greater drops in glucose levels with exercise. Insulin's main job is to bring glucose levels down. And so I think it's really important that we talk about what can we do with automated insulin delivery systems for exercise. So these are some of the illustrations that will be published very shortly in the position statement. And we can talk about what to do before and during activity. In this case, a system that we have in the US is Control IQ. It's a tandem Control IQ system. And this insulin pump, there's variable options that you can do and differences that you can try depending on if you're doing planned exercise or unplanned activity. On the bottom, for every one of these different pumps, we show if your glucose levels trend down typically with exercise, or if they're pretty stable, or if they tend to go up, you may have different strategies that you want to try. Now, I don't have time to go through every single piece of this figure, but just know that this will be online shortly and will be shared with everyone once it is available. But one thing that we do talk about is with planned activity. With an automated insulin delivery system, it's encouraged to set an activity target, or in this case, exercise mode, 1 to 2 hours before physical activity, or PA, when glucose levels are expected to decrease. So sensor glucose is SG. So when you tend to see glucose levels dropping with activity, we often encourage setting a glucose target well in advance of activity. Planning in advance is important, and we'll talk about this in a second. Other options in this case are, like we talked about, reducing the bolus or prandial dose of insulin with the meal before exercise if your activity is happening in the next 1 to 2 hours. So the summary for planned exercise, where possible, is plan ahead. Needing to set a higher glucose target can be really helpful because it takes a long time to get insulin out of the circulation. So trying to plan ahead, set that glucose target in advance until the end of activity if hypoglycemia is typically occurring with activity. It's important that with different checkpoints before exercise, you might want to modify what you're doing based on that glucose level. If glucose levels are high, you may not need extra carbohydrates, but if glucose levels are lower, you may consider a small snack before activity. Consider reducing the insulin dose with the meal before exercise. Like we said, soften it, so around 25 to 33%. And consider small carb feeding if glucose levels start to drop below 126 during activity. You may also need to modify the decisions that you make after exercise. Like we talked about, with increased insulin sensitivity, you may want to decrease the amount of insulin by 50% if you're noticing hypoglycemia in recovery with the meal after exercise as well. So what happens for all of our non-planners? Not everybody is going to say that I can plan ahead for exercise. In fact, I work in pediatrics, so we see this a lot. Many kids that I work with will say that I don't plan ahead for exercise. I don't even know what I'm doing in the next 10 minutes. So with spontaneous exercise, we encourage small amounts of carb feeding during activity if glucose levels start to drop. So the position statement highlights if glucose levels start to drop, it says below 7 millimoles per liter, which is the equivalent of, in milligrams, less than 126 milligrams per deciliter. Encouraging carb feeding based on the glucose trend arrow on the CGM device. If you don't have a CGM trend arrow, we're talking about automated insulin delivery, doing a finger poke can still be helpful. We talk about small amounts of carb, anywhere from 3 to 20 grams if glucose levels start to drop with an automated insulin delivery system during exercise. Doing this every 20 to 30 minutes can be helpful to avoid hypoglycemia before it happens. Now, with the Omnipod 5 system, so this is another automated insulin delivery system, we encourage, again, taking a look at whether you're doing planned or unplanned activity. And again, on the bottom, what the typical glucose trends are during activity. You can understand what may be some recommendations to try. So a little bit differently here when we talk about unplanned activity. So remember, spontaneous, I haven't set a glucose target well in advance, an hour or two before. With the Omnipod 5 system, that higher glucose target is called activity feature. You can still set this immediately at the start of exercise if you expect sensor glucose levels to decrease. So like we said, if CGM tends to drop with activity, set that activity feature at the onset of exercise. You may want to consume more carbohydrates, so 10 to 20 grams of carbohydrates if sensor glucose starts to drop below 126 milligrams per deciliter. So those are some of the recommendations with the Omnipod 5 system. In summary, for spontaneous activity where you're not planning ahead, we talk about there are many challenges with automated insulin delivery system. Largely, this is because glucose levels can change very rapidly with exercise, often quickly dropping or quickly rising with exercise. We also know that continuous glucose monitoring systems, or CGM, can lag behind blood glucose. We also know that too much active insulin in the body It might be too high in those levels for continuous aerobic exercise. Too much insulin tends to cause glucose levels to drop. But there are several actions that you can take to limit the amount of activity-induced dysglycemia, so both highs and lows. You can consider changing the glucose target or consume small amounts of carbohydrates with exercise. So next, we're going to talk about physical activity under special circumstances with diabetes using an AID system. So there's less published literature in this area, but what's really important is that for this position statement, we talk about, well, what can we do for activities that are very long duration? Sometimes we have people that are skiers or snowboarders and spending 6 to 8 hours on the mountain doing very long duration events. Or sometimes I meet marathon runners or ultra marathon runners that are doing prolonged activity. Sometimes with these activities, if they're doing things like swimming and the pump is not waterproof, they may have to disconnect the pump for prolonged periods of time. So I won't be able to talk through each of these recommendations, but these are the things that will be covered in the position statement. How do we manage competition stress during physical activity? What do we do for water-based activities? How do we deal with contact sports where we have a lot of devices on the body? What do we do with high and low ambient temperature? The weather outside, if it's very hot or very cold, do we have any challenges? What about at altitude? Like we said, skiing or snowboarding in the mountains, sometimes in high altitude. So we'll talk about a few of these considerations. With long duration physical activity events, some considerations are with very prolonged exercise, if you're cutting back on the insulin dose so you don't experience hypoglycemia, you may have low insulin delivery. This may increase the risk of ketones if you're doing an activity for many, many hours. We know that we can't stop insulin delivery, but if insulin delivery is stopped for a prolonged period of time, that can increase the risk of ketones. This can also, with long duration activity, you're burning a lot of energy. You may have hypoglycemia during the activity because you're exercising for such a long time. But we sometimes see when you cut back on the insulin dose, you start to exercise for many hours, we sometimes see rebound hyperglycemia in recovery. So some possible strategies. Consider regular carbohydrate feeding during the activity. And we typically say this because carbohydrates are needed to fuel the body, particularly if we're doing something like Ironmans or marathon running, very long duration activities. Now, to prevent insulin deficiency, we don't want to just stop insulin delivery for 6 to 8 hours if we're doing a very long duration event. Otherwise, we may avoid, if we see prolonged insulin suspension or no insulin delivery, we may see glucose levels rise and an increased risk of ketones. So we may want to not set that higher glucose target 1 to 2 hours before until the end of the activity. We may only want to set it for a couple of hours and then let the pump resume. What's really important with long duration physical activity events is to monitor the CGM glucose values closely. So consider setting that higher alert threshold on a CGM. With certain CGM systems, you can now get the system to alert you before the glucose levels have already dropped below 70. So you can set those alerts a little bit higher on certain CGM systems where possible. So what do we do for competition stress during physical activity? Well, some considerations with competition stress is adrenaline, a stress response. Sometimes I ask patients, do you notice anything different from practices to games? And sometimes you'll hear that during practices, often glucose levels may drop. They are a little bit less stressful. You're using a lot of energy when you're exercising. But then what we hear is that in many cases with stress responses during competition, that adrenaline response and that increase in cortisol, increase in lactic acid, the liver is pushing out glucose at a faster rate than the muscles can take it up. What happens with this is that with this competition stress, sometimes glucose levels rise. So this hyperglycemia might happen before the event. If someone is stressed out or very nervous about the event, we often see anaerobic or stressful competition, sometimes causing a rise in glucose levels. So some possible strategies: monitor the amount of insulin on board. With an AID system, like we said, if glucose levels start to rise, the automated insulin delivery system may start to deliver insulin because glucose levels are climbing before exercise. So it's important to monitor how much insulin is on board before exercise. Staying hydrated is important because during competitions and stress, if you're dehydrated, your CGM system can also be inaccurate. So it's important to stay hydrated during competition. We also want to possibly avoid setting a higher glucose target. We talked about if there's a risk of low blood sugars, you may want to set a higher glucose target. But if glucose levels tend to rise, we may not want to set that higher glucose target on a pump before activity. If glucose levels go above basically 270 milligrams per deciliter, in this case it's here in millimoles, you can consider a partial manual correction of insulin. So taking some insulin if your glucose levels start to rise with competition. So in summary, we know that with these special circumstances, contact sports, long duration activities, disconnecting the pump for many hours, and all of these different activities in water or all of these different scenarios, there's a lack of evidence for these special circumstances in people using automated insulin delivery technology. So some other considerations around how to manage this that aren't discussed in this paper, we're having to understand what happens with menstrual cycles. We're starting to see that different phases of the menstrual cycle might cause different responses to exercise and glycemia. We also see that with active insulin, the more insulin on board, the more difficult it tends to be with activity. We also know that with different adjunctive agents, now we're seeing more individuals on Ozempic, on SGLT2 inhibitors, different types of diabetes medications that may cause challenges around exercise and diabetes. So oftentimes we have to trial and error or refine our management strategies for activities. So really, it's up to your healthcare providers to provide support for all types of physical activity. You don't always have to know exactly what to do, but talking to your diabetes care team is really important so you can build a plan together. So a couple of other areas that I wanted to share with everyone and some exercise resources for diabetes. We've recently started to build out a website called Diabetes Wise for Exercise. Now, Diabetes Wise has been a website that's existed and started by Dr. Corey Hood and colleagues at Stanford. And this website is a neutral and unbiased platform where you can learn about different insulin pumps, different continuous glucose monitoring systems, a lot of information on how to pick the right device for you. But what was missing on the website was there wasn't really much guidance around exercise. So as of this past year, we started to add a number of exercise resources for individuals with diabetes. You can use that QR code to open it up. Otherwise, we can send you the link for this website after the presentation. But this website can offer guidance on strategies for exercise. If there's anything that was missed here, you can find out more information. Even for sometimes people are interested in what happens for kids that are very young. There's a little less research on kids under 5. We are now adding more content to the website on how to manage glucose levels with activity. We also have added to the website how do we navigate, for example, keeping devices on the body during exercise? Sometimes I have families or patients tell me that they sweat a lot during exercise. That perspiration can make it very difficult to wear diabetes devices on the body. Devices can fall off, and this can be really challenging, particularly because these technologies are meant to last for a certain amount of days. So we talk about different patches and glues and things that you can use to try to keep those devices on body during sport. So sometimes people are wondering, where can I go to get some of my questions answered? For example, after this, where can I go to maybe go to a community and ask other people questions around my diabetes? So we have now launched Diabetes Wiser, which is our online community where we have various different topics that we discuss. By no means is it only focused on exercise. We talk about various different things, diabetes devices, how do we use insulin pumps for exercise, how do we use activity trackers, how do we manage traveling or pregnancy with diabetes. And then there's other sections that we talk about, like water-based activities, competition. And every month we're trying to launch an Ask the Expert session. So next month we'll have one. And this session is different every month. I did one last month and it was about exercise and diabetes. Some of these are about mental well-being, mental health. And we have different people that are leading them each month, and they're often experts in the field. So you can join and follow along. You can use that QR code, or we will share this with you after as well. You can create an account. It can be totally anonymous. You don't need to put personal information if you don't want to. And you can share any of the questions that you have around exercise and diabetes. So, to summarize, we know that diabetes technology has come a long way, but we also know that exercise challenges remain. How do we encourage physical activity? Well, the first step is to understand how to manage diabetes across the spectrum. People with type 1, type 2 diabetes, children, adults, older adults, every one of these groups and populations has different guidance and strategies. So we know that there are a number of consensus guidelines that exist. They should be used as a starting point for exercise. We know that at the end of the day, we need individualization and tailoring for approaches around exercise. This is really important because you might be wondering, how do I tailor everything when I read these consensus guidelines? As you use that as a starting point, remember to use your diabetes care team for support. If you have any questions, your diabetes care team can be there to support you. And of course, I am here along the journey. So you can reach out to me if you have any questions, and I'm happy to take any questions at the end of this session. So I just wanted to say thank you, everyone, for joining along. I know it is the evening for everyone. I will stop sharing and see if there are any questions from the audience. Okay, thank you. Someone has asked a question. What is the best practice for someone without diabetes who doesn't see any form of progress after hours at the gym and weight hasn't really been changing in about 2 weeks? This can be really challenging. We often see that there are challenges with weight loss when it comes to exercise. It's difficult for me to be able to answer that without knowing the full background and history. A lot of the times we want to understand what the nutritional intake looks like day to day, what some of the challenges may be, what type of activity you're doing. But from a more general perspective, we often see that if you're doing the same type of activity and not really seeing any progress, consider trying to mix up or cross train. So doing something a little bit different. So if the same activity hasn't been doing much for weight loss for you and isn't as enjoyable, we want to try and find something that's going to be different, mix it up, and see how your body responds to a different stimulus. So another area that we often focus on is many times I talk to individuals that are cutting back on nutrition and dietary intake quite aggressively when it comes to exercise. They are trying to achieve weight loss and they're exercising and they're not noticing any changes. It would be important to talk to your diabetes care team, have a log of maybe your dietary intake for a couple of days, because sometimes I've noticed that either the foods that are needed to fuel the body, sometimes those overall daily needs aren't being met. If you switch all of a sudden to a very low carbohydrate diet, you may not actually be getting some of the nutrients that are needed. And so this is why the dietary part is really important in addition to lifestyle and exercise habits. So of course, without having too many specifics, I think a couple of areas that I would encourage is mixing up the activity. Maybe not overtraining. It's important to ask how much activity you are currently doing. If you're meeting exercise targets and not noticing any, weight loss, there might be a consideration of either changing up the activity you're doing or doing a different duration or intensity of activity. Sometimes, like we said, doing higher volume, like we said, 4 to 5 days per week of lower intensity exercise can be more beneficial for weight loss. If we tend to not enjoy that type of activity, we should mix it up. On one day, we might want to do resistance exercise. And sometimes, if we encourage ourselves to do group classes, we can have that accountability from other people to make sure that we're making it to the gym and making sure we're staying active. But oftentimes, if you're kind of seeing a kind of stable part in your weight and not really weight loss, it would be really important to start to log possibly activity and what you're doing daily, but also to be logging nutrition and what you're eating throughout the day and bring that to your diabetes care team. Great question. And I think one last piece I just wanted to add about that. So I know it says after about 2 weeks, not many changes. Unfortunately, it takes a long time sometimes for changes to be seen. And so I think it can get really frustrating to see that in 2 weeks, nothing is changing and weight hasn't come off. But we often talk about that even to build a new habit, it often takes over 21 days. And so, if we are not noticing any differences, I think patience is really important. There are going to be ebbs and flows in how we are managing, even without diabetes, but just making sure that we can engage in activity. But how we're exercising and how much is also really important. So someone asked about hypoglycemia, not understanding exactly what that meant. So hypoglycemia is just another word for low blood glucose. Again, because this is encouraging exercise for people with diabetes, generally that could apply to type 1, type 2 diabetes, pregnancy and diabetes. Often people that have diabetes and with exercise tend to see fluctuations in glucose levels. So with diabetes and activity, we tend to see increases in low glucose levels. So blood sugars dropping below the usual target range that's recommended. That range will be a little different for type 1 diabetes, for example, glucose range of 70 to 180. And if glucose levels tend to drop below 70, we call that hypoglycemia. Oh, I see a question now in the chat as well. So, what's the solution for MS if you mean multiple sclerosis? So again, I think encouraging activity that doesn't increase pain or make it difficult to do activity. I think it's really important that you talk to your healthcare team and your care team to discuss what type of activity is not causing any inflammation or any pain or any kind of difficulty for activity. As we talk about, certain activities are helpful for joints and things like swimming, if we have any knee pain, can be helpful activities. But I think the challenge is how do we do activities that we are not having any issues in terms of physical pain? So I think that would be my first way to encourage, but hopefully that helped answer your question. Awesome. Well, I don't see any other questions. I can still stick around. So I just wanted to say thank you all so much for joining, and we will be happy to share this online. Please reach out if you have any questions. I shared my details. And we are very excited to see you again soon. If you have any questions, please reach out. Thank you so much for taking the evening to spend some time with us and learn about exercise.